Hello everyone, welcome to the CPT Guidelines tutorial series. In this video series, the first topic we are going to see is Evaluation and Management Coding Guidelines. So please follow my channel and check out my other playlist as well. Evaluation and Management Guidelines Part 3. Evaluation and Management Service Categories. Number 4. Emergency Department Services. Emergency department services, that is in short form ED, are provided in a facility open for 24/7 for immediate treatment for urgent conditions, including serious illness or injury. So the documentation requirements are history, examination, and medical decision making. Unlike other EM services, emergency department codes do not require time documentation. So unique features of emergency department EM codes, the patient status is irrelevant. That is, used for both new and established patients, there's no distinction. 24/7 rule, services must be in a designated emergency department open for 24 hours a day. Time not affected. Codes are not time based even if critical care is involved. Location specific. Applies only in facilities meeting the definition of ED or CPT. Let's look at some sample question. This is the continuation of previous parts. So the question number 9. A 40-year-old patient presents to the ED with severe abdominal pain. The physician performs a detailed history, comprehensive examination, and high complexity medical decision making. What is the correct EM code? A 99,281, 83, 84, and 85. So please take your CPT code book and find the answer. In the CPT code book, you have to go to the evaluation and management section contents. So there you have to go to the emergency department services. So when you go down, you can see emergency department services, new and established patient, and other emergency services. So let's click this new and established patient. So when you go down, you will get the code. So in our question, the decision making is high complexity medical decision making. So the first code 99,281 is emergency department visit for evaluation and management of a patient may not require the presence of a physician or other qualified healthcare professional. 282 is EM visit for evaluation management of patient which requires medically appropriate history and examination and straightforward decision making. 283 is low level of medical decision making. 284 is moderate level of decision making. 285 is high level of decision making. So emergency department visit for the evaluation and management of a patient which requires medically appropriate history and examination and high level of medical decision making. So in our case, emergency department visit, high level of medical decision making. So the correct code will be 99,285. So the correct answer is D. Question number 10. Which of the following is not a requirement to use emergency department EM codes? A. Service must be performed in a facility open for 24/7. B. The physician must document the time spent with the patient. C. The patient may be new or established. D. The service must involve urgent or emergent care. So the correct answer is B, because the time is not a required component of emergency department EM coding unless billing for critical care separately. Question number 11. In what scenario should a provider not bill 99,285? So there are 4 answers available. Please take your CPT code book, go to the code and check the answers. So when you go to the code 99,285, it says emergency department visit for evaluation and management of a patient which requires a medically appropriate history and examination and high level of medical decision making. So when you go to the code, it's asking for incorrect answer. So the first one, A, is high severity case with comprehensive documentation, though that is correct. B is ED patient seen with flu-like symptoms and straightforward MDM. So this is not the correct answer because the 285 says high level of MDM. So this is straightforward. So this is the wrong answer code. So that is the answer. So answer B. If you see other codes like ED visit where the patient had chest pain and required urgent ECG and laboratory work. So that is a high level MDM. And D, life-threatening trauma case managed in 24-hour emergency facility. So that is also high level of MDM. Okay, the next category is critical care services. There are 2 codes, 99,291 and 90. The critical care is direct delivery by a physician or other qualified healthcare professional of medical care for a critically ill or critically injured patient. Critical care involves high complexity decision making to assess, manipulate, and support vital system functions to treat single or multiple vital organ system failure and or to prevent further life-threatening deterioration of the patient's condition. Examples of vital organ system failure include, but not limited to, central venous system failure, circulatory failure, shock, renal, hepatic, metabolic, endorespiratory failure. These things are available in your CPT evaluation management guidelines, so you have to highlight these things. And the critical care is usually but not always given in a critical care area, such as the coronary care unit, intensive care unit, pediatric intensive care unit, respiratory care unit, or emergency care facility. So here you have to know some exclusions. Inpatient critical care services provided to infants 29 days through 71 months of age, that is 6 years of age, are reported with pediatric critical care codes, that is 99,471 to 76. So we will see when you come this chapter. And inpatient critical care services provided to neonates 28 days of age or younger are reported with the neonatal critical care codes, that is 99,468 and 69. So these are not included in these codes. So services for a patient who is not critically ill but happens to be in a critical care unit are reported using other appropriate EM codes. So the following services are included in critical care when performed during the critical period by the physicians or providing critical care. So this is available in your CPT evaluation and management guidelines. So you have to highlight these things. So first one is the interpretation of cardiac output measurements, then checks X-rays, pulse oximetry, blood gases, collection and interpretation of physiologic data such as ECG, blood pressure, hematologic data, gastric intubation, temporary transcutaneous spacing, ventilator management, and vascular access procedures. So these procedures are no need to be separately coded because these are included in the critical care. Any services performed that are not included in this listing should be reported separately. Okay, let's look at some questions. The continuation question. Question number 12. A physician provides 110 minutes of critical care to a patient with acute respiratory failure. Which CPT code should be reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is 110 minutes of critical care. Okay, go to the evaluation and management chapter. There go to the table of contents. Here's the critical care services. Once you go there, you will find following guidelines. So if the critical care is less than 30 minutes, the critical care code is not used. That is the appropriate EM codes are used. So if it is 30 to 74 minutes, 99,291. If the duration is more than 74 minutes, you can use 292. Then you can, every 30 minutes increase, you can use the multiplication. For example, first 74 minutes, you can use 99,291. Each additional 30 minutes, you have to use the 292 with multiplication. So in our case, the duration is 110 minutes. So 110 minutes means first 74 minutes included in 291. So remaining 36 minutes. So first 30 minutes, you can use 99,292. Other 6 minutes, you can multiply this 292 into 2. So the correct answer will be 99,291, then 99,292 into 2. So the correct answer is C. Question number 13. Which of the following is not included in critical care time and should be reported separately if performed? A. Chest X-ray interpretation. B. Mechanical ventilation management. C. Central venous catheter insertion. D. Reviewing lab results. So if you highlighted the CPT guidelines, you will easily find this answer. So here the correct answer will be central venous catheter insertion. The certain procedures like central line insertion are separately billable, not included in critical care time. Question number 14. A patient is admitted with sepsis. The physician documents 60 minutes of critical care and separately performs endotracheal intubation. What is the correct coding? So there are 4 codes available. Take your CPT code book and find the answer. Here you have to highlight this is 60 minutes of critical care separately performs endotracheal intubation. So if it is 60 minutes, obviously it is 291 critical care code. I'll show you. So if it is 30 to 74 minutes, that is 291. So the first code is 99,291. Separately performs the endotracheal intubation. So in this case, you have to find the code for endotracheal intubation. You can use the alphabetic index. There you have to go to the intubation, then subcategory of endotracheal. Demonstrate this in detail in future tutorials. So when you go to the codes, you will see 31,500 is intubation endotracheal emergency procedure. 31,502 is tracheostomy tube change prior to establishment of a fistula tract. So the correct code will be 31,500. That is intubation endotracheal emergency procedure. So in this case, the correct code will be 99,291 plus 31,500. So the correct answer is B. Question number 15. What modifier is needed for a separate emergency management service, non-critical, is provided on the same day as critical care? A. 59, B. 25, C. 76, D. 24. So the modifiers are available at the back side of the front cover. So you can go to the CPT code book. Here you will find the modifiers. So the first modifier given in the question is 25. When you look at the modifier 25, significant separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. So this would be the correct modifier. If you look at other modifiers like 59, that says distinct procedural services. So the 24 is unrelated to evaluation and management service. 25 is significant separately identifiable evaluation and management service. In our question is, what modifier is needed if the separate EM service, non-critical, is provided on the same day as critical care? So this is related to the critical care. So the correct answer will be answer B. So this is the end of critical care services. So please subscribe my channel and check my playlist for other tutorials and stay with me. Thank you.